Hi, morning, Malvika. Welcome to this podcast
Hi,
called,
Vandita. Thank you so much for having me.
yeah. So this podcast is called Brain in You, exactly for the reason that we discuss a lot of topics which are around brain, around neurodiversity as well. So I know you are a speech language pathologist, you're a speech expert, you're a neurodiversity expert. So just to give you a quick background, um, Ayurved, the brand that I work for is works very closely with individuals on the spectrum, and we work with them closely mainly through nutrition and a bit of therapy, a bit of getting experts like you who can guide them. So that is the purpose. So when you respond, you might keep that audience in mind. And just to give you an age group understanding that most of the parents, not all, but most of the parents would be parents of children of a younger age, somewhere in between, I would say 3 to 8, 3 to 10. So in your responses or in your suggestions, probably if needed, you can divide the age group or you might keep this age group particularly in mind. So we'll start, but before I start, Malvika, why don't you just introduce yourself?
For sure, yes. So my name is Malavika, and I am a speech language pathologist, and I've finished my master's in speech language pathology. I started my private practice accidentally, I would say, because of COVID, and it has been flourishing, since then. And it's been 4 years, and it's been quite a ride. It's been quite a journey. Met a lot of families, and I work closely with a lot of children on the spectrum as well. But of late, I have also branched out into working with children with cerebral palsy, stammering a lot,
Okay.
Down syndrome, and children on those clinical populations as well.
Excellent. So, we do have children who have Down syndrome. We definitely have children who stammer, and not just children, young adults as well. So that is fabulous. So let me start by, and there are some very punchier questions that I've put for you because these are the questions we normally get from parents. So I'm just gonna throw them at you and just hear your perspective on them. So parents normally they often come to us, Malvika, and they ask this particular question as to how long before speech therapy works. So are there any signs that they should look for to know that progress is genuinely happening?
Yes, definitely. And I think it's a great question to ask because we need to start gauging if therapy is working, right? Because it feels like we're hitting a dead end wall even before we begin. So I think that the preliminary set of characteristics to understand if speech therapy is working for your child is very important. So the first thing that I would say that your child must be very comfortable going to these sessions. All right. Yes, not every day is the same, and I get that children are having their own struggles as well. But on the large scale, it must be an environment that the child is very well set into, and
Mhm.
that's the kind of environment a good speech therapy session is ought to create, right? So that would be number one.
Right.
And are your children copying, imitating your therapist over here? When you come back and do the same activities, is it still something that the child appreciates? All these are very good indicators to say that, oh yes, the child is now setting into the rhythm of speech therapy, right? So these are the preliminary characteristics. Now, before a
Okay.
child starts speaking, getting on the larger picture, I would say that there are a lot of other. So we usually say that speech is like the fruit on the tree, right? Meaning it's the last to develop. The speech is the last to develop. But there are a bunch of stages before you get to the
Mm.
part of speech, before the speech skill is acquired, which should be all the things that are indicating the child to move towards speech. Which would be pointing, which would be looking correctly, which would be imitating us, which would be saying a couple of words, which will be substituting a couple of words every time for a particular thing, which is the child developing a way, an ability to say that, hey, I have understood and comprehend what you've told me, and I choose to express it this way for now.
Okay.
Right? So these sort of preliminary stages are good guidelines for us to understand that, oh, hey, this is working. The child is picking up things that have been taught in speech therapy sessions.
Excellent. Excellent. That first statement that you said, Malvika, so we often end up speaking to about 500 parents every day. Um, And I think this comes up very, very often that my child goes to a therapy session. It takes a long time to take that child there, but then settling down is the biggest struggle. They often end up being cranky, they cry, they cling on. So I really doubt how much progress happens. It's tough for the therapist, it is tough for the child as well. So I think that's a good indicator. And I was going through some of the work that you do, and you do emphasize on a play-based speech therapy, which you feel is, the heart of the practice. So I'll ask you for a quick tip here that can you share two fun and practical activities that parents can do at home today to boost speech or social skills?
Definitely, yes. So the first thing that I feel like, see, all the play-based activities, once it
Mm,
is now, when I put it forward that, most of the activities need to be play-based. The first thing that parents ask me is, okay, then what sort of toys should I buy? Okay, what sort of materials should I buy? Right? So, and the answer to that, and the answer to pretty much the entire of speech therapy being carried out at home, is that you need to remember that you are the toy. You need to
mm,
be the one playing with the child, interacting with the child, and creating the magic in every activity that you do. And that is a lot of, that is a lot of work. That is a huge task in itself, right?
mm, mm,
So use regular items at home. That is something
mm,
that should really gravitate to, and that makes it more sustainable. So the
mm.
child makes sure that if this comes, if this particular opportunity or this particular object is given to the child is now more inclined to come to you with that particular thing. Before it was just lying around in the house, no big deal. But now that you show the child how to play with it, the child is going to start implementing
Sure.
it by themselves. Or they want to run to you to play with the same object. So I would say use water. Use a lot of
Okay.
water. There are buckets available in everybody's house. So sensory play like that, in fact, is very, very good and calming for neurodivergent children, right? So maybe drop fishes in the water, ducks in the water, and then say, oh, let's go pick up the duck. Let's go pick up the duck, right? So small things like that, and the child is more inclined to imitate after you, which is the basis for prolonged betterment in speech oriented aspects of development.
Mm,
And
mm,
one more activity that I would say is keep a lot of pots and pans, or all these glasses that you use for drinking water. Maybe not glass ones, but like silver ones. And you can always play like an xylophone like activity over there. All right. Again, something that works on a lot of rapport creation. Just you repeating and imitating after the child gives the child a sense of goodness and a greatness, like that. Oh, that Amma is imitating after me, Appa is imitating after me, so then maybe I'll try this, maybe I'll try that. It gives an opportunity for the child to
yeah.
attempt something by themselves. All right. Now, is
Excellent. Got
this
it.
enough to get translated into speech and everything else that the child starts doing? No, but this is definitely a starting point.
Yeah. 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 I love that line that which toy to use here, you're the toy. You
Yeah.
need to be. Yeah, that's excellent. Yeah. And especially that age group, when the child is hardly maybe 2 years, 3 years old, I think parent is or the mother or whoever is at home, the caregiver is the best toy. Yeah. But in this journey, Malvika, I'm sure you interact with tons of parents or during the class, outside the sessions generally, or even when you were studying. What is that one misconception about speech therapy for autistic children that you constantly hear?
That speech therapy is just about speech. I can't say this enough, but maybe the term is very misleading for parents as well. We cannot put the ball on their court and say, hey, it's your responsibility. But the primary aim of speech therapy for any child that's neurodivergent, or any child for that matter, is to make them independent in terms of communication, right? That's what we want it fiercely for all our children, that they are independent and they can thrive in the society with just minimal accommodations as much as possible, right? And speech is just one domain that a speech therapist works on, but my primary goal is to make the child communicate in one way or the other, so that they are independent, they can get what they want, not just in their house, not just in their home and play environments, but throughout the society. And this sort of advocacy that professionals are doing, and many other people are doing, in terms of accepting other forms of communication, is ongoing. But if we are going to say that, okay, after the system is established, then I'll start training my child in an AAC system, is not going to work, right? And it is going to be very important to train your children very young, to make them understand the importance of communication, because this skill is not hardwired. This particular skill is not hardwired in neurodivergent children. So we got to train them behaviorally in order to do something that is meaningful in order to get what they want. So
Yeah.
that is
Yeah.
most common misconception, I would say, is about speech therapy.
Yeah. I think I have realized this too in the last 4, 5 years of speaking to parents. Very, very, very rarely, and especially never in the beginning, did I hear these two terms, speech and communication, differently. For them, speech was communication. So if they don't have speech, then there's no communication. I think that is something I've started emphasizing on myself, and good you brought it up, that it is communication is, a much brighter, a much broader term, and it encompasses speech, may or may not have speech, but communication, making the person or comprehending, making the other person understand what you want to say. I think that's more important, not just in the home setting, but everywhere.
Definitely.
So many parents are confused about this particular question, which I hear a lot is, when do I start using assistive tools or visuals or, augmentative communication? So what advice would you give to them, Malvika, that when should they begin and what is the right way of starting?
I would say as soon as possible. As soon as it seems like when the child starts, many parents come and sit in front of the assessment. During the assessment session, they say, "Come and sit in front of me and say, ma'am, he understands everything." When I say, "Okay, now hold the plate, cut it with a knife, and eat the cake." Right? When I tell him a complex instruction like that, which is 3 steps, he fully understands. He can perform it really well. When I tell him, "Go get Papa's phone and put it on the table," or any sequential command like that, my son definitely gets it. I know he knows all these things, but he is just struggling to express. But he can't tell me when he has to go to the restroom. He is not able to tell me when he is in pain. He is not able to tell me if he wants to take the snack box, which is in the upper shelf above, and he does all sorts of gymnastics to go get it, and I'm really scared if he's going to fall down. These are practical things that parents put forward, and the first thing that I tell them is, "But does he come and tell you?" And he's like, "No, ma'am, he will just grab it by himself." But then I ask him, "All right, has he attempted to tell you before? Has he taken you there, shown you with his hand, or has he done any sort of attempts to indicate what he wants?" And they would immediately say, "Yes, yes, he'll do all that. He still tries to do all that." But do you understand that that is the child showing that they can
That's,
comprehend
yeah,
this
that's
request?
communication.
They know to request you for that particular thing that they want as well, except that they don't have the typical means of doing it, which is through speech. But the child is doing it through hand leading or any other activity like that. Now, let's say you give them a card or you give them a particular device and that will speak for them. The child will now use the device to get what they want with no frustration in between, with no panic attacks for the parent and anxiety inducing situations for the parent where the child climbs up and above in order to get something as simple as a biscuit packet.
Hmm.
Right? So in order to make them better, you need to give them some sense of success. And if we set the bar very, very high and ask them to keep going above and above until they meet that particular bar, then we are sort of setting them up for failure, and that's not helping them move forward and wanting to communicate.
True.
Right? So as soon as possible, give them a system, implement a way through which these children will be able to speak and ask and communicate for themselves.
Yeah, yeah, yeah. Just let me take you to set of parents who have just been told or diagnosed that your child is on the spectrum or or just speech delay. So let's focus on that. What should parents who aren't sure, you know? Oh, yeah. So let's talk about parents. Let's say they have self-diagnosed it, or they can actually observe that my child is, struggling with speech, and relatives or neighbors' kids are moving on with speech. So, what should parents who aren't sure whether their child's speech delay is just that or something else do in those early months?
Preliminary thing would be to avoid all these WebMD and Wikipedia diagnosis and go to an actual professional, right? I think that is very important. That you go to a professional who is certified, who is qualified, who is capable of handling the diagnosis and therapy of the child. The earlier you go, the earlier a parent goes for a speech therapy professional help, it is very likely that the problem is going to be, it is not going to cause a ripple effect. All right. It is very likely that early intervention will work very well for every child, provided the parent is also in good awareness to say that, "Let me go check it with a professional." So the primary thing would be to go to a professional. The secondary would be to ask them for a better perspective of how to understand this, because I see this a lot, and a lot of parents who come to me for therapy also write on LinkedIn and all these parts where they talk about how before I could process my child's diagnosis, I was told what to feel about it,
Hmm.
right? So once they have a diagnosis of autism, the first line of thought or the first line of action for a parent is to again Google it and find out what is autism. And we know the kind of things that are present on the internet about autism and any neurodivergence for that matter, right? So I think a better aspect would be to talk to the professional itself. Say, help me understand what autism is. Help me understand how it has manifested in my child. Help me understand what is it that I need to do. Help me understand that, break it down for me. Talk to me like I'm a 6 year old and tell me everything that I need to do in order to cope with my child's difficulty at this phase, right? I think that
Yeah.
those would be very helpful in understanding the reality of the situation instead of a one-off situation that one might read on the internet.
Hmm. But imagine a scenario, Malvika, that this particular parent is living in a small town, which is
Mm,
normally reality, by the way. Parents are living in small towns, they don't have access to doctors. Some of the doctors they do have access to may also, for whatever reason, may not be able to diagnose that it is autism. Probably too young a child, probably they don't want to label the child so early. I don't know. There could be multiple reasons because I know of such stories where the child was not diagnosed till the age of 4.
mm,
So, in those cases, and yes, there is society you need to take care of, there are neighbors and relatives. In that scenario, let's say the mother, especially who's, spending most of the time with the child, is able to sense that, that mother's instinct is there, that something is not right with speech. Is there something they can start doing for the next few months, 6 months, or a year before they feel or get the courage or the conviction to go and get it diagnosed?
definitely. Yes, that is possible. And I think that's a great question because this is, like you rightly said, this is the reality of most of the cases that we see sometimes, right? It is that a parent is, or the parent does not have enough family support in order to get to therapy. And, maybe even the husband is not on the same page as the mother, right? So it becomes very difficult at that point in time. What is important, like you rightly said, is the gut feeling, that this identification and acknowledging that no, this child needs help and I'm not able to handle it all by myself, and ask for the help you
Yeah.
need. And for the preliminary work that one can do in the house, in their home environment, in order to better the situation, I would say is to play a lot with the child, observe a lot of things and bring it to the table while and if and when you want to meet a professional. See, because a lot of it, when I see a child for the first time, and we know all of us know this really well, that if I've seen 100 children with autism, I've seen only 100 children with autism,
Mm.
right? The 101st child that I see with autism might be a whole different category and a profile that will not fit into the whole different 100 children that I've seen before, right? So give us more information, give a professional more information on what is it that you've observed so far. And that will quickly help us draw a plan and chalk out what the strengths and weaknesses of the child are. Which are the parts that need more, help right now? Where are the parts that intervention is needed right away? Right? So that is also something that a parent can do. A lot of play activities with the child, especially sensory oriented activities like playing with water, playing in sand, and a lot of body oriented play where they're running around and doing all of that is actually helpful. It is
Got it.
very helpful to, and there is a school of thought that says, movement also aids in speech.
Yes.
All right. While it is a very, it is something that is still under research, it is very helpful to understand the strengths and weaknesses of a child as and when you play with the child, because that
Yes.
is the language of the child.
Of course, of course. I think that part of the brain, which is cerebellum, which is all about body balance, movement, everything, those five critical parts of the brain, everything comes into focus when you do all these sensory activities or you're on a movement, you're doing something. And yeah, I agree. And there's something that we tell our parents quite often, or rather our experts tell the parents is maintain a diary. Keep making notes, keep making notes, keep making notes. And you will be surprised with your own progress over months that what
True.
all your child. And I think it will help the specialist also to understand your child better. Yeah, so makes sense. But yeah, okay, so there's this very the next question that I'm asking you is something that comes very often, and it's true. The progress stalls. This is how parents put it. Progress nahi ho rahi, initially madam बहुत progress देखा फिर progress नहीं हो रही थी. This is something we hear very often, that when progress stalls, what's one practical adjustment you recommend, whether it's changing the therapy environment or reporting method or even timing of the session, anything. I'm just giving you examples, but what is it that you advise to parents or to such examples that come in front of you wherein you feel that the progress has stalled, or parents tell you that the progress is stalled?
Right. Yes. All right. I think the primary would be sometimes to adjust the lens with which we are viewing the child, because what they mean by progress is a child being able to speak and communicate everything via speech, and that's the kind of progress that they're expecting sometimes in certain situations. So if it is that they're looking at, then probably we'll need to reevaluate what we're looking at as progress in the first place, right? So a child not being able to look in a particular way or tell me with just eye pointing that, oh hey, I do recognize it, I do see it, versus the child now being able to point, a child now being able to imitate a certain few words. All right, all that is good indications of progress in the first place. The second thing that could, what are the other reasons why progress could probably be delayed or elusive or whatever, is that there is a possibility that this particular method of treatment is not working for the child. And by that I mean, there are good number of therapists who say, I will work on speech only. So when the target is very high during the speech therapy sessions, the child is going to every session feels like it's unproductive. The child is going to keep running around because what you're expecting out of the child is too much. So maybe sort of, this is something that we learn, and it is even a part of ABA, that there is something called as discrete trial. Okay, you keep giving them smaller and smaller, you keep breaking down the steps into multiple things. And if you know that they're able to do part A and part B of step one, they're going to get to part C. They're going to get to step two thereby.
Yeah.
And step three, and so on and so forth. And that's how these children accumulate these goals and strength.
Yeah.
Right?
I think I
So,
agree with it. Yeah. I mean, that is something that probably, so we have noticed when we do these therapy sessions, so the way we conduct is, again, I was, something that I learned, Malvika, was that, like you said, one person says, if I'm a speech therapist, I don't know anything about anything else, but I'm a speech therapist. Then the other person is an occupational therapist. Then you have a special educator, then some sensory specialist and behavior specialist. So then the parent feels, okay, I need to choose. But like you said, it's pretty holistic, it has to be together. That is what we realized, that when we started making our in-house curriculum, we kept all these 5 things together, all the 5 specialists together in one room, and we said we're going to design it together. And we made such tiny goals. And there was a time when the parents started feeling they started questioning that, we're moving very slow. And that's exactly the point that you're making, that you have to, it's not you, it's the child.
exactly. We do
Yeah, the
take it for
focus is the
granted.
child. Yeah,
Yeah.
yeah,
Because we can do a particular thing, or that we see another child of ours doing the same thing. You
yeah,
take it for granted that this child will be able to do. And if
yeah,
it is not, it is the child's character being talked about, in the sense that, oh, he's
yeah,
very stubborn. He just
yeah,
doesn't listen.
yeah,
He does not want to do this, ma'am. He can do all other things, but he does not want to speak. Right?
yeah,
So we need to keep reminding ourselves in these situations that when a child is not doing something, it's most likely because that he's unable to, not because he doesn't want to. Because no
yes,
child does not, a child does not know the demarcation between not wanting to versus not being able to. It all looks the same way to us from the
yeah,
outside. But
yeah,
there is a clear demarcation that we can
of
do
course.
as professionals, at least.
Yeah, yeah. I will end this session, but I have one very important question. And since you are a speech specialist, I want to ask you this, that you know that you've heard of speech regression. And that's very common, I feel, that at least I get to hear of this. And not everybody really understands it very well. I want to hear from you that what is speech regression which happens in the world of autism? Why does it happen?
So during the time of diagnosis, which is when autism starts presenting itself, sort of manifesting itself in the child, around 18 to 20 months, right? So these are children who have acquired speech skills. They have acquired about even two word combinations saying amata, daddy no, or daddy come, daddy sit, or something like that, right? These are two word combinations. The child has gone up to that level. Now, the child not even responding when the child's name is being called is devastating. It's somehow very, very shocking for the parent, right? So, there is that is one way through which autism does present itself in the early stages. And that's one part where we say there has been a regression in speech, which is contributing to our diagnosis being made, right? So the second thing that can happen over a period of time after the diagnosis made, maybe by 4 years of age or 7 years of age, one of the possible reasons could be because of seizures, right? So maybe when there is an abnormal activity in the brain that's intense enough to change the chemistry of the brain altogether, the presenting features and the behaviors of the child that comes after the seizure is going to be different. Is going to be very, very different from what it was. And one of the things that we see through that is that the child will start going back to the previous ways and the primitive ways of communication, let's say. All right. And this
Of
could
course.
be a very vicious loop. I get it. And such changes in the brain needs to be attended to only via medications. So
Yeah.
anti-seizure drugs will be very, very important to make sure so that we make sure that the children are kept in the same level, in the equilibrium level of functioning. So that all other learning in terms of walking, in terms of speaking, in terms of picking up anything, education and all that is not taking a hit. So
Yeah.
sometimes regression happens even for typically developing children, by the way. All right, because of seizures. That is also possible.
Yeah.
The extent to which and all that is definitely very, very different from one child to another. But apart from the other reasons that could be present for the reason of regression, seizures is one of them and the
Yeah.
most common of them.
Yeah. And I just want to add here, since you mentioned seizures, that not every seizure is visible. There are silent
Yes.
seizures which parents may not be aware of, but it's going on. Yeah. And that rewiring that you're talking about, that typically, if I would say what is the most classic case of regression in autism, it could be that rewiring, which suddenly hits you between the age of 4 to 6. That's the primitive time when it hits. So yeah, thank you. Thank you for this, Malvika. It's been wonderful. I mean,
Thank
I had a list of these 7, 8 very direct questions to ask you, and you have taken them up and explained them so thoroughly. Thank you so much.
thank you, Vandita. Thank you. This was lovely. Thank you.
Yeah.